Patients who were either scheduled for surgery or have had their surgery delayed or postponed or were waiting to get on the surgery list for their hip and knee replacements, we always tell our patients try to stay as active as you can. The theory is that if you go sit on the couch, you're going to stay on the couch. And what we don't want is inactivity to breed stiffness in the joint, weakness of the muscles, which will then make a recovery from their surgery harder. So we certainly encourage people as much as they can in the environment that we're working in to stay as active as they can.
There's always a question of what kind of medications that people can take prior to surgery or in that pre-surgery time frame. Acetaminophen is by far the most recommended. Normally, for normal adults, they can take up to 3,000 to 4,000 milligrams a day in divided doses. So regular strength, it can be anywhere from about 9 to 12 acetaminophen.
So when it comes to activities while we're all in this holding pattern, again, really it's activities that you can tolerate. If you're the patient with the arthritic hip or knee, you don't have to feel like it's a form of torture to get out and walk, but walking is probably the most accessible form of exercise. But we do encourage people, if they do have a bad knee or a bad hip, that they use a pair of trekking poles or hiking poles, which will significantly reduce the strain on their arthritic joint. So walking at this stage is probably the best form of activity. If there's access to a stationary bicycle or some type of pool where water-based exercises can be done, that's also certainly a good choice.
As far as whether essential oils and pressure points being effective prior to surgery, they can be. There's controversy. There's no real scientific evidence, especially, let's say, CBD oils. People have been using, and anecdotally, they have been of some assistance. But again, right at this point, probably trying more the conventional acetaminophen type things. Over the counter, there's even what's called a TENS unit that's been available, especially with backs. They are available now over the counter. So I advise if people are in severe pain, go ahead and get a TENS unit and contact your physical therapist as far as being able to apply the patches in the appropriate areas.
So when it comes to if there are specific exercises a patient can or should not do, perhaps. There are some excellent resources online through honorhealth.com, as well as the American Academy of Orthopedic Surgeons, American Association of Hip and Knee Surgeons, where a patient just with a simple Google search can link into some excellent resources and videos and things like that that will show them good exercises to do, because certainly an arthritic hip or knee or even shoulder wants to get stiff, and if you do not move it, that stiffness will get worse. So we don't want that to happen in this waiting period. So we want people to move their joint. In orthopedics, there's a saying that life is motion and motion is life, and that certainly goes for those who are waiting for their joint replacement surgery.
There's always a question of whether diet has any role in inflammation and can be a benefit. There are anti-inflammatory recommendations as far as diets go. WebMD has a very nice summary of all the foods that you should try to continue taking and those to avoid. In general, it's a well-balanced diet. You're trying to avoid processed foods, red meats, sodas, sugars, if you can avoid those. Fruits and vegetables are very good. Beans, nuts, fatty fish. Again, generally what's recommended as far as a healthy diet.
This virtual visit option is real. And the government, Medicare, the insurance companies recognize that. They really, relax some of the requirements that were put on us, which before were quite onerous. Change isn't always easy for either us as physicians or our patients, but in this case, I think it's going to offer significant benefit overall.
If you're interested in contacting either your surgeon or physical therapist ahead of surgery, these days most offices have the availability of telemedicine. Even just simple telephone conversations can be done.
If you are a patient at home or a family member, a patient at home who knows that they need surgery, perhaps their surgery was even scheduled and then was forced to be postponed, what we would tell you from a physician standpoint and as an affiliated physician with Honor Health, I would share with you that we in general understand where you are. We know that from a physical and psychological standpoint, it is something that you've already committed yourself to, and once that commitment is there, you want to just get things done as soon as as you can. And we understand that. If it was a family member of mine who needed surgery, what would I want for them? And I'm going to apply those same standards to every single one of my patients doing elective surgery.